In Nigeria, although there is still a lot to be done in terms of the health goal, much has already been achieved.
This office was specifically set up as an offshoot of government office to be an addition to the main ministries, the MDGs, to achieve the Millennium Development Goals. It's an additional funding to assist government achieve its 7-point agenda, the Vision 2020, and other government, the MDGs and other government development agenda. And it's been quite challenging, coming to this office and working with the small unit here. It's been it's been a great experience, and it helped me in putting my own little quota in. As I told you earlier on, I oversee capacity building in the office of the MDGs. What we do is that additional funds from the DRG debt savings some of it was applied to the head of service since 2008 to improve the capacity of civil servants across the federal and state governments.
In consonance with the conditions of the debt relief gains, Nigeria channels $1 billion annually to pro-poor projects. Since 2005, funds have been provided to the following sectors that impacted directly on the advancement of women: health, youth, education, agriculture and water resources, housing and environment, women affairs and social development. These areas have also in the past years been specifically targeted for financing gender equality and women empowerment from debt relief gains.
Could we utilize these debt relief gains in a way that would impact in the lives of Nigerians? It was a hard-fought debt relief. For years, the president had been on that crusade. So in getting it, the mandate was clearly to put those debt relief gains to use. And to make sure that we got impact on the ground. We developed it, as I said, in consultation with ministers who were key to this: Minister of National Planning, the Minister of Finance, Health, Education, and came out that what we would do is that, knowing that the MDGs were not new, that we would add resources to health sector, for instance, to improve the indices of maternal mortality and child mortality. Add to the education so that every child would get a full cycle of education. So to be additionality to existing budgets.
If you're going to do gender equality and women empowerment, you can't have just a national women policy, but because gender equality talks about equality and equity between men and women. So you must have a national gender policy which looks at issues that affect both men and women separately. So we funded them to develop a national gender policy. And the Ministry of Women Affairs had, outside their normal budget of salaries and expenditure, they had less than 100 million for programs that will have impact on the lives of women and children. And the MDGs from 2006, this office has ensured through funding from the debt relief gains that they have had a steady flow of funds between 500 million to about 2 billion every year annually. Those are remarkable increase in their budgetary allocation. And there have been so many pilot projects, there have been so many interventions flowing from the federal, state, even to the local government level.
Debt relief gains are also being used to procure drugs and equipment for maternal and child health care. The office has also been using part of the debt relief gains to provide rural water supply, irrigation, small earth dams all over Nigeria. This is meant to ensure access to potable water for rural dwellers so that waterborne diseases are reduced and water is available all year round for livestock and other users, thereby increasing food production.
For me, one of the greatest things that have happened to my life is actually working in the MDG's office. Because I'm working in the development field is one area that really you have the opportunity of actually touching the lives of ordinary Nigerians. Yes, indeed, quite okay. One is a physician, you treat patients, but there is quite a few number of people that you can actually touch their lives. But whereas in MDGs, so far, you touch the lives of virtually every Nigerian and every nook and cranny of the society. your impact is actually felt.
Particular attention has also been paid to women and children. The status of Nigerian women has also improved significantly in recent times. This has been greatly accelerated with the return of the country to democratic rule in 1999. There have been improvements in educational attainment by women, and they have indeed attracted greater visibility as more women are being appointed to key positions in the public and private sectors. This has also been greatly attributed to the hard work of the staff of the MDGs office.
The orientation you get when you come into the office, the OSAP MDG office, it helps us to see through such challenges. And so far in the education sector, yes, we have been dealing with the main ministry, the parastatals, sometimes the institutions and so on. But because of the support the office gives, we try to attend to all the requests, all the needs as timely as possible.
The achievements recorded in Nigeria's MDGs have been possible as a result of transparency and accountability. Funds allocated and approved for MDGs projects and programs are channeled to the appropriate and designated purposes. This has kept the MDGs office accountant busy.
Actually, part of the challenges are the release of funds and some of the programs, like when they go on monitoring, some of the projects are cited in areas that are very, very difficult to reach. So that also used to create problem for us. And also culture. You know, MDGs, especially when it comes to women, they are very particular, especially the maternity aspect of it. And our culture interferes with the program also. But on a general note, it has been a successful program.
Women empowerment issues stretches to children and youth, as the woman is also the educator in many homes. Meeting up with the targets of this goal has not been easy. However, the leader in charge of the gender desk at the MDG's office is tirelessly working hard to see to it that women and the girl child in Nigeria are given their deserved right in all aspects of their lives.
When you say you're a gender desk officer, you have this kind of resistance from people already. Okay, she's coming to promote issues that have to do with women. She's coming to talk about women emancipation. And because it's a new role, I couldn't find anywhere in the ministries or departments or agencies where I could go and say, oh, who is a gender desk officer here? Tell me how you do your job. Let me learn from this. There was nothing like that in the system. This office had the first ever gender desk officer as far as government is concerned.
Addressing the issues of women empowerment requires adequate attention to education. In Nigeria, the proportion of girls enrolled in primary, secondary and tertiary education is still lower than that of boys. However, among the faces behind the success rates of MDGs in Nigeria is the Minister of Women Affairs. She is also helping to spread knowledge about gender issues.